Okay, I think we're gonna, oh, excuse me, get started. Good morning. Welcome to Cardiac Sciences Grand Rounds. And it's a great pleasure to have Dr. Coderre today. Dr. Coderre is at the Division of Gastroenterology. He's a professor in the Department of Medicine. He's been with us since 1997, and he has had several educational leadership roles and teaching roles. He's most recently served as the Associate Dean of Undergraduate Medical Education. He is a highly nationally, internationally respected teacher, leader, and colleague. He's been recognized for his excellence through many awards. He's also a good coach on several sports, and I think he does some speed skating and stuff like that, which I could never do as a South American. I don't even know what ice is. Anyways, it's a great pleasure to have Sylvain with us today, and he's going to give us a great introduction on using cognitive psychology principles in structured, clinical, and online teaching, something that we are doing and will continue to do very frequently. Sylvain, thanks for joining us today.
Well, thank you, Carlos. Yes, I started speed skating last year. So after watching my son speed skate for 10 years, I decided to give it a try. It was very humbling. It's not the same as hockey skates. I can guarantee you that. Different sport, same ice. But yeah, so today I'm going to, I don't have a lot of slides, so I tend to go over this very sort of in broad strokes and talk about a framework that we've developed here locally that's based on so local and international evidence. And really, it's the framework that I use every time I think about any sort of teaching session, whether it's a 5-minute session at Second Cup or a 1-hour presentation. It's really a 3-step framework and that's really the main objective today, is to go over this framework and give you some ideas about how we could apply this framework to teaching, to setting up curriculum, or even to mentor students. And I see that Sarah's here, and that's the framework that we that is used in undergrad education to mentor students. So thank you. And so I will, first of all, thank Dr. Kevin McLaughlin, who's a nephrologist known to people, who has helped to develop these slides with me. So we'll go to the next slide. Oh, and I want to introduce Terry Molesky's here. We're from the Office of Faculty Development and Performance, and that's my current role. And this is why I got the invitation today. So again, thank you. So I'm employee of AHS and UFC, but no other relationships with commercial interests. We'll go to the next slide. And I've tried my best to follow the UFC copyright. I just, Carlos or Karina or Terry, there's a message here from Vikas about slides not being clear. I don't know.
Mine are fine, so it's Vicas's old computer. We should get him a new one.
All right.
Maybe some educational funds from the division can help on that.
Right. All right, we'll go to the next slide. Yeah, so these are my objectives today. It's really to present this one slide framework that, as I mentioned, is, I think, useful in several aspects of education, whether it's teaching, course or curriculum design, or mentoring. And I'm not going to overload you with data. I think I only have 2 data slides to show about supporting the framework, but I'm going to show you where this comes from. If you're interested, it comes from a paper that Genevieve Desi, one of our general internists, was the lead author, and she summarizes the literature around this very well. So we'll start with the next slide at a question, and if you want to answer this question in the chat box, if you don't, that's fine, but I just want you to think about what's the difference between acquisition of knowledge, skills, and attitudes versus learning of knowledge, skills, and attitude. What's the difference between acquisition and learning? I'll give you a minute. We have collection versus application. Okay, I like that. So we got one answer. It's definitely the best answer so far. Collection versus application, and I think that gets to the point. But we'll see if anybody else has thought about this, or it's really, I guess, what I'm thinking question, but goes to definitions, important definitions that I'm going to present here. Okay, so we'll go to the next slide. I just want to, I think what you said in that answer, Satish, is accurate. I know what, but need to know how. Okay, that's good. Know how. Okay, so I think hopefully the message I'm going to leave with you today is that when we talk about true learning, so learning has two phases, two broad phases. There's the acquisition phase, and then there's the retrieval phase. And so when I asked the question about acquisition versus learning, the difference is that acquisition is really one phase of learning. Acquisition, as I'll present to you, is the phase where we take new information, whether it's a knowledge or a skill, and we place it into long-term memory. But that's only one part of the process. True learning means that you'll be able to retrieve it later. And I've bolded retrieval here because I think often in education and in medical education, we think a lot about how am I going to get someone to acquire knowledge. I hope if there's one thing I hope get you to think about today is how do I get someone to acquire knowledge, but perhaps more importantly, what kind of tools can I use or tricks can I use to help someone retrieve knowledge? And that is a phase of learning that we sometimes forget, and the methods that we use for both phases are not the same. So there's aspects of teaching that will help acquisition and may actually hurt retrieval, and vice versa. But we need to think about both phases. And every time I think about any kind of session, whether it's, I guess as I mentioned, an hour session or a curriculum or 5 minute, I think of these three. I've broken acquisition down into two phases. I think about how do I promote storage? How do I promote encoding, which is basically queuing into long-term memory? And how do I promote retrieval? So those are really the three phases of true learning: storage, encoding, retrieval. And I'm going to go over these one by one and sort of give you some ideas about what the literature is around this and how can I be, as a teacher or curriculum designer, pay attention to these three areas and improve these three areas in my teaching or curriculum design. I'll go to the next slide. So this framework comes from this paper that I mentioned before, that this is the local paper, but a lot of the data that's presented in this paper comes from international studies. So we'll go to the next slide and I'll show the one slide framework. So essentially this framework outlines two broad steps, and these are the broad steps that I've outlined. The number one is acquisition of knowledge, and number two is retrieval of knowledge. So if you look at the green box, the green square on the left-hand side, you've got a learner, and at the bottom right, you've got a task. So that task could be a knowledge, could be skills, could be attitudes. And that learner needs to go through two broad phases for that learner to be able to apply. So when in the answer, Satish's answer says application, I think what you mean is actually exactly what I mean. And the know-how means that it's one thing to acquire information or skills, but ultimately you need to retrieve it. You need to retrieve it at the appropriate time. And so in the first phase of learning, when we're talking about acquisition of information, I said the first step is storage. Storage means that information needs to get past the learner's working memory. And the working memory is that light blue square that is in this framework. And so the first phase of learning, the acquisition and storage phase, implies that the learner that's in front of you has a limited working memory, as does everybody in the world. And this has nothing to do with your learner and nothing to do with the skill of the teacher. It's just a reality that our working memory is limited. And it's limited probably to 2 to 4 complex topics in one session. So when we're thinking as a teacher of the first phase of learning, that knowledge acquisition, storage of information into long-term memory, that that light blue square is the critical part of this framework, that working memory. You have to know and appreciate and realize that that learner has a limited working memory, as does everybody, about 2 to 4 concepts. And again, I'm going to go over these 3 steps in a bit more detail throughout the talk. But the first phase, when I'm talking about storage, I'm talking about getting information past the learner's vulnerable working memory, limited working memory. The second phase is the purple rectangle, which is long-term memory, which is infinite. So working memory is finite, but long-term memory is infinite. And the second phase of acquisition is, how do I promote cueing or coding? Cueing means I'm giving that learner a cue so that later on they'll be able to retrieve that information from their long-term memory. And there's techniques we can use as teachers and curricular designers to help learners with better encoding of information into long-term memory. So storage and encoding is acquisition. And then for the learner to later on use this task, or as people said in the chat box, apply the task or knows how, they need to bring it back to working memory and retrieve it. And there are definite techniques that we can use as educators to help promote retrieval of information. So I'll go over these 3 steps, the storage, encoding, retrieval in detail. And so we'll start with the next slide. And if there's questions, by the way, I had my chat box open here, so I am looking. So the first phase is that storage strength, is that knowledge acquisition. How do I promote storage? Well, how you promote storage is to realize that the learner in front of you has a limited working memory, 2 to 4 basic or complex topics, I should say. And so too much, too fast is not good. Distractions, multitasking, anything that increases attention demands, especially the more novice the learner, the more anything extraneous will be harmful to their acquiring of information. We need to pay attention to that. And what that comes from, if we go to the next slide, is the cognitive load theory. And I'm not going to overload you with theory. I think there's only a few, 2 theories that I present. But the central notion of cognitive load theory is that human cognition, and that really means our working memory, has limits. And when we're talking about, if you remember from your psychology 101 course that you took, they talked about our memory having 7 boxes. Well, those were studies that were done with humans trying to remember numbers, so digits. So that's not complex, that's very simple. When we're talking about complex topics, so if you're teaching anything about management of acute coronary syndrome, that learner in front of you has the ability to process, probably 4 is probably the upper limit. It's probably 2 to 4 depending on their level topics. So that working memory is limited in space, but it's also limited in time. So if as learners we don't get a chance to rehearse the information, meaning actually sit back and think and process the information, it's lost within 20 to 30 seconds. So what's the message there as a teacher is that the first phase of learning, the acquisition storage phase, I really need to limit the quantity of information. I need to limit any distractors, particularly in a novice. And if I'm lecturing for an hour, it's an excellent lecturing technique to actually pause, to actually stop the lecture after maybe 2 complex topics, and try to turn your lecture into a small group. Have people, yes, aging does affect working memory. Yeah, so working memory is a frontal, no, yeah, sorry, here's my poll, but the poll will come later. So we'll just ignore that for now. Yeah, so aging does, so the working memory location is actually the prefrontal cortex. And there does seem to be, certainly in any sort of um, dementia process that affects the frontal lobe will. But the one thing, Naren, that really affects working memory in the frontal cortex is fatigue, actually. So particularly when someone has, when you're trying to teach at 2 a.m. and your resident is tired, you probably don't have 2 or 4 pieces of information that you can. First of all, I don't think I have the energy to teach 2 to 4 complex topics at 2 a.m. They really only have room. As you get tired, your working memory, that 2 to 4 probably drops to 1 to 2. So how do I identify the two? Well, I think that's really, that's an excellent question. So, we all have, I think one of the things that as a technique to think about is we all have a fair, especially in clinical teaching, we all have kind of similar learners. I mean, we have residents, we have clerks. So, and we all have topics that, if I have a week with a clerk in GI, I mean, there's probably 5 topics that I want to get through to make sure they learn about inflammatory bowel disease, cirrhosis, so kind of bread and butter topics. And within these topics, I think I know from experience, from feeling, like what are the 2 to 4, if I think about ulcerative, my inflammatory bowel disease topic, well, it's really differentiating ulcerative colitis from Crohn's disease, and therefore what symptoms would be the hallmark symptoms of both conditions, depending, of course, on the level of the novice. And so that's a kind of one is to develop scripts. We all have we all have similar topics that we feel are critical. I think it's to pause and think about, well, if it's a 3rd-year clerk, what are the 2 to 4 really critical pieces of information that they need to, so that they need to acquire? I think rehearsal after introducing new elements is really to pause. So if I was giving this lecture, if I was actually in person with you in a lecture theater right now, I would probably say, okay, I'm going to throw up a question slide and get you to talk to your neighbor or think about or rehearse that piece of information. So that would be in a lecture format. In a clinical scenario, so if I'm teaching for 5 or 10 minutes, I think a discussion is a chance to rehearse, because what a discussion does, and as I mentioned, discussion will help retrieval as well. But what discussion does is it pauses the new information. So as long as the discussion is not introducing new elements. So for example, if you're teaching about, the demands of myocardial oxygen demand, elements, that you've presented heart rate, contractility, wall tension, and maybe 1 or 2 categories of drugs, that you pause for a discussion without introducing new information. So that's the tricky part, is that as soon as you introduce new information, you've now overloaded that working memory. If you get a chance for a learner to rehearse and discuss, you probably can reset that working memory to 2 or 4 new topics. But what I would just advise is to think about, okay, I have these important topics. These are my 2 to 4 critical elements. I'm going to just present those and stop there. And I think a discussion is an excellent point. In a virtual environment, so a virtual lecture, I think one of I hope in my presentation that I adhere to my own rules. So I've already, I think, made the point, I hope, of that 3-step framework. So storage, encoding, retrieval. Again, I'm at the storage phase. So I'm now pausing. Essentially, I'm pausing at the storage phase to discuss with you, so that essentially I haven't hopefully introduced any new material. I'm giving you some ideas about how to present this. But yeah, so in the virtual environment, I think the storage component doesn't change. It really is about 2 to 4. And I think the chat box, using the chat box, is, for Zoom, gives the learners a chance to. So often, if I have a 1 hour session on Zoom, I would pause at this point, maybe put up a slide that says, okay, why don't you put in the chat box 2 to 3 important elements of storage or cognitive load theory, and give that learner a chance to pause and actually type into the chat box. And that I think is a good way to allow the learner to rehearse the information. So we'll go to the next slide. Yeah, so I'm getting to that retrieval phase. So really, if I go back to my framework, Naren, I'm really now the learner is that green square in the left-hand side. I'm actually still at that working memory, first working memory blue box, blue square, which is really, if I'm going to have a chance for the learner to apply it and retrieve, there's no way you can apply or retrieve something that you haven't acquired. So now I'm trying to just get some information past working memory into long-term memory. And now I'm going to discuss about ways we can improve the coding in long-term memory so that the final phase, that retrieval and what you're describing as application phase, which is really hopefully in 2 months they can remember, pre-renal, renal, post-renal. And so that, yeah, so, but if we don't get it past working memory in the first place. So I guess the example I would give, Naren, is if you have a novice clerk and really one of the important topics for you is renal, pre-renal, renal, post-renal as a general approach, but you spend that 10-minute discussion talking about the pathological findings of various glomerulonephritis, you can see how a novice would lose, like what concept are they actually going to remember. So I think this first part is, let's pick the topics that are absolutely critical and stick to that, so that for that particular teaching session, so that it gets into long-term memory. Now, how can I improve the coding in long-term memory? So we'll go to the next slide. And there's 4 ways. And I think a lot of this you're probably doing already instinctively as teachers. And I'll go through these 4 individually, but the first is to provide an organizational structure. So I hope that this framework is an organizational structure that's built on 3, storage, encoding, retrieval, something that I can remember. Pre-renal, renal, post-renal is a powerful way for Naren to organize renal failure. That doesn't mean that Naren necessarily thinks about that when he's solving a case, because he's got a lot of experience and can probably recognize a case without going through this. But for a novice learner, it's a very powerful way to organize or code our information. Improving coding through desirable difficulty, I'm going to spend 1 slide of data on. That's one of my 1 slide of data. And desirable difficulty is really probably a term best applied if you're a curricular designer. And it's not about making things difficult intentionally, but the more a learner has to work to get the information, so in other words, small groups versus lectures or flipped classrooms, anything that makes the learner work just a little bit harder than sitting back and being passive is that desirable difficulty. It will code the information much better in long-term memory. Improving understanding or sciences, which cardiology is very deep in, is a great way of coding. And my number 1 thing is spacing or interleaving content. So I hope that if I can convince you of anything today, and if you ask me as an educator now, as Carlos said, I've been here since '97. If there's one thing that I think we don't do well enough as teachers, and is a very powerful way to teach, is spacing. We tend to block teach. We tend to teach on one subject and not come back to it. Spacing is, from a cognitive perspective, the most powerful way to allow learners to code information well and retrieve it later. So we'll go through these individually. next slide. So a structure I've mentioned, I think we all instinctively teach around some kind of approach. And what this does is allows us, for anemia, for example, this codes a lot of information in long-term memory in one simple uh, point of information. And the more novice the learner, the more knowing macrocytic, normocytic, microcytic is probably good enough. The more advanced you get, then you can layer on to these approaches. So teaching some kind of structure is a very powerful way to code, to cue information into long-term memory. We'll go to the next slide. So it turns out teaching sciences works. And you've known this as cardiologists forever, but those Starling curves and the factors, the cardiac output is heart rate times stroke volume, and mean arterial pressure is cardiac output times total peripheral resistance works. It's a very powerful way of coding information and allowing someone later to retrieve. So basic understanding turns out, and I'm not going to present, there's a lot of literature on this, it works. But now we'll get to my desirable, next slide, my desirable difficulty, which I think is an important topic for teachers and curricular designers. So this is a study, and this has been reproduced in medicine and various aspects of healthcare, in non-healthcare, as I'll show you in this slide. But the idea here is that this was a study. Bjork and Bjork are the two kind of proponents of this desirable difficulty. And in this study, what they did is they asked, the task was for learners to recognize portraits or paintings from 12 obviously well-known painters. So they had Van Gogh, 6 Van Goghs, 6 Da Vinci's, 6 Picassos, etc. And they asked the learners initially, and that's the left-hand slide, left-hand part of the slide, how would you like us to teach this? Would you like us to teach all the Picassos at once, and then all the Van Goghs, and then all the Da Vinci's? And most of the learners, as you can see, want to learn in a blocked fashion. So they want to see all the Van Goghs, see all the. But then they randomized the learners to two educational interventions. One, they actually taught in a block fashion. So they showed all the Van Goghs. And in the other one, they showed one Van Gogh, then one Da Vinci, then one Picasso, and then they came back and showed the next Van Gogh, the next. So that's the dispersed or so-called interleave teaching. And you can see that as much as learners, and I would say teachers, like to teach in block fashion, the learning was better when you teach in dispersed or interleave fashion. If you go to the next slide, and this would be my one slide that I would love for you to remember, and I think instinctively we know this, is that forgetting is not a problem with acquiring information. So acquiring information, putting information into long-term memory is not, forgetting is not a problem with that. It's a problem with retrieval. And so if you look at that forgetting curve on that slide, the red curve, if I test you right after this session, which I'm going to, your retrieval will probably be pretty high. But if I test you in 2 months, you'll be on that forgetting curve, and everybody is. It doesn't matter who the learner is, and it doesn't matter who the teacher is. We are all on this forgetting curve if we only hear information once. The second time we hear information, we start to climb onto that, that green curve. And you can see that, the third time, the fourth time, the fifth time, we solidify that green curve. And so we can build encoding or cueing and build retrieval strength through dispersing content. So going back, Carlos, to your question about those 2 to 4 points and how do I decide? Well, the 2 to 4 points is really about knowledge storage. So getting things from working memory to long-term memory. But what I would get you to think about, whether it's in a lecture or in a clinical environment, is, do I tend to teach in a block fashion? So do I tend to say, okay, today I'm going to teach you about cirrhosis. And then I'm not going to teach you about cirrhosis again during this entire rotation. Or, as I've started doing purposefully, if I teach about cirrhosis on Monday, I will come back to it on Wednesday, at least in a very, summarized fashion, in hopes of getting the learner from that red curve of forgetting into the green curve. And the more time that learner has to go back to their long-term memory to retrieve something, the more likely they are to be able to apply it or retrieve it later. So I think this is one area that I would say as a sort of main message today is to think about, am I a teacher or curricular designer that teaches in a block and then never comes back to it? Or am I a teacher that teaches a small amount of information and then I actually come back to it at some point later on in, if it's a week. I mean, it's harder to do in a 1 hour lecture, but you can by using quizzes or breaking the lecture into small group, as I'm going to do in a few minutes here with just a brief quiz. So we'll go to the next slide. So we're now into the last part of, so this is a summary of the 4 ways I can help in coding. I can provide a structure. I can make it a little bit harder for learners to acquire information like small groups or flipped classrooms. I can provide science, and I can disperse the information. We'll go to the next slide. So now I'm in the last part of the framework. So as a teacher, I've thought about, well, how am I going to improve storage? I've thought about how am I going to give the learner a better cue or encode better? Now, how am I going to, as a teacher or curricular designer, promote retrieval strength? So retrieval strength is about 3 things. One is teaching in the appropriate context is really important for retrieval. And I think obviously we do that very well as clinical teachers. The more time you practice retrieval, so testing and retesting. So when somebody mentioned earlier a discussion, well, a discussion is a test. It's not a multiple choice test, but as part of that discussion, I'm testing the learner to see if they've even acquired the information at all. And if they have, and I'm testing or quizzing them, I'm actually promoting retrieval. So they have to go back in time. And the third way of retrieval strength is dispersing rather than block teaching. And many of you will know Alan Jones, who was Associate Dean when I landed here in Calgary. And I've always remembered what he told me, the 5 most dangerous words of medical education is we have already covered that. We should get those 5 words out of our vocabulary. So if you're a teacher in cardiology for a week and you taught about the management of acute coronary syndrome on Monday, you should never, ever apologize for reviewing it, going back to it on the Wednesday or Thursday of that week that you have with that learner, because that is a very powerful way to force that learner back into their long-term memory and retrieve it. And that is that, application phase that many of you have talked about. You have then half a chance that that learner will be able to retrieve the information later. So we'll go to the next slide. And this is my mind mapping. Well, yeah, mind mapping is really that long-term memory code. So that organizational structure or algorithms, some people use, so in the when we talk about especially management and algorithms. Sorry, Carlos, I missed your question. Are there any visual tricks? Yeah. So retrieval is actually visual. So using every sense you can helps. So how many times have we heard a song that we haven't heard for 20 years? And not only do we remember the song, but we remember where we were when we heard that song. And we haven't thought of that event for 20 years, but it's in long-term memory. So how did that song cued, was a cue for that piece of memory that we have in our long-term memory. And so a visual, yeah, so a chart or that's what we attempt to do. Sometimes I've remembered talks. I can't remember the topic exactly, but I remember the funky slide. So the idea would be to hopefully mesh that slide with that visual. But I think the visual or the auditory, Carlos, is really about a cue. It's that, and it provides not only so that anemia slide that I showed you, macrocytic, microcytic, normocytic, is a code. It's a cue in memory, so that's a way to, and the better it's coded, the more likely someone's going to be able to go back to that long-term memory and retrieve. So emotion, cases, visual, auditory. Why do we remember bad cases that didn't go so well? So why do we remember those so well? Is that it provides a very powerful cue in our long-term memory. It's coded, that topic is coded with that piece of information. So you can do the same with visual, or you can do the same with auditory. Um, and I remember cases that I've never seen that a colleague told me about because it had such a powerful emotional component to it. So yeah, but the real part of retrieval is if you if you're gonna promote retrieval, get people to retrieve. So this is what this study showed, and this was neurology topics, and I use this with when I teach and think about teaching my kids, is actually sometimes, so what they did in this topic or study, they gave learners a lecture in neurology, and then they said, okay, for a quarter of you, we're going to give you study material. For another quarter, we're going to give you study material, and we're going to give you ways to self-explain the material, so ways you can teach yourself. A quarter of the group were randomized um, testing and self-explanation, and a quarter were randomized, to just testing, and a quarter were randomized to testing and self-explanation. And what they found is that long-term retention is promoted by testing. So if you want to help someone retrieve, we'll get them to retrieve. Studying more is probably not going to, if you're studying enough, that's not going to help retrieval. Studying will help acquisition, but retrieval is helped by retrieval. So when we test people, when we quiz them, when we ask them questions, when we get a discussion going, that promotes retrieval. And the best of the best retrieval is to ask someone to teach. So if I have a learner, and I don't do this with all my learners, it has to be a special learner, like not a learner that's confident enough. But if I have a group of learners, I might ask a learner that when we taught something on Monday, I will say, well, do you mind on Wednesday teaching the learners that didn't hear this topic? You teach the others. And so not only am I forcing that learner to retrieve the topic, but I'm actually, if they actually can go back and teach, then they have retrieved it. They will be able to retrieve it later. They will be able to apply it later for sure. Um, yeah, the bad memory stuck in our mind. I mean, it might be unconscious repetitive retrieval, but I think partly is that if you look at the memory focus of memory, basal ganglia, and the amygdala. I don't know if I say that word well, but the amygdala is where emotion and memory are stored, and it's actually a relatively big part of our brain for the amount of information that goes there. So I think it's just that emotion, and it just cues so powerfully that is why we retrieve that information so readily. So we'll go to the next slide. And the next slide is really the framework again. As a summary, some people have asked me about how this applies to Zoom, and we'll go to the next slide. So I think what I've said really applies to Zoom. I mean, when you think about storage and limiting amounts of topics, that is the same thing you can do in a virtual environment. So pause frequently, go to the chat box, get people to type in, answer the questions right away. Because answering, I don't like saying I'll answer that question later, because first of all, you forget to answer it half the time. And secondly, I think pausing and answering the question now allows people to refresh their memory. breakout rooms in a, and I didn't have time this morning, but is a way to promote desirable difficulty or encoding. So it's a little more difficult to acquire information when you have to go to a breakout room and discuss material in a small group. And retrieval can be promoted through Zoom by polling, quizzing, which is a test retest strategy, which I'm about to do in a second here. So we'll go to the next slide. And those were my real three objectives: to teach about how this framework applies for teaching, course and curricular design. If I have time or interest from the group, I can present one slide on mentoring and present just a little bit of data. So I'm just going to go to the next slide. And it's going to look at the question, encoding and retrieval and age-dependent phenomena. Yeah. So I think that's unclear um, in my mind. I'm not sure that, short of, like, obviously someone who has an actual dementia, Andrew, obviously, as just mentioned, like working memory being in the frontal lobe. Yeah, I think it would depend on the location. I think what happens over time, the phenomena that we see where the risk, I would say, of age and experience is that, and this is maybe a different topic, but is that, when we solve clinical problems, we tend to use, as we gain age and experience, we tend to use what's called system one. So that's pattern recognition. So, that patient who's diabetic and hypertensive, who is shoveling snow, who gets crushing chest pain, I mean, right away, you've got a diagnosis of acute coronary syndrome in your head, right? So that's a system one way to diagnose. And I think what's been shown in the literature is that over time, what novices don't tend to use that as much because they just don't have the experience. Where we start making errors over time is that we tend to over rely on this what's called system one, or non-analytical or instinctive type reasoning. And we don't fall back to our analytical reasoning, to our, okay, this is what I think it is, but let me take a second here to make sure and think about that I have this diagnosis correct. And I think that's probably the most powerful age-dependent cognition problem, is that over-reliance, that premature closure, that saying, okay, I've seen this a million times, so this is what it is. And we all, I think, find ourselves maybe, hopefully not guilty of it, but maybe at risk of doing that, is to say, okay, well, wait a minute, just take a second here and think about this. This pattern of liver enzymes is not quite typical, maybe, and think about it so I think that is more, obviously, as soon as you have an actual dementia, that's a different scenario. But I think, to me, when I think about age-related issues, I think about over-reliance on our ability to just recognize patterns. We still need to go back and analyze cases. And really, I guess, analysis is about going back into our long-term memory and retrieving information. So I think that's more of an issue with age than maybe problems with. So I think strategies, to me, is to always think of yourself as that novice learner. And if you're coming to a diagnosis too very quickly, is to just sit for a second and say, okay, have I actually ticked off the boxes of a more deep analytical approach? Okay, so I don't know, Carlos, I saw the poll briefly. We'll go to the poll. If it's working, that would be great. If not, we can just answer questions. And so we'll go to the next, to the poll, or to the first question. And this is a way.
Yeah. Sorry, the poll is working, but if I can just get everybody to answer the first question only, until is ready to move on.
Question at a time. And this is really my way of promoting retrieval. It's also my way to see if people have learned anything. So we'll go to the first question. So we'll go question by question, Terry. So which of the following is not a step in the proposed learning model presented in this session? How long do we have, Terry, for each question?
30 seconds if you want or less.
Normally I see the answers, or well, I see the answers at the end.
Okay, there's no answers so far.
Okay. Do you want to go to the second question then? So
Yeah,
yeah.
the thing is that I can't see if I'm trying to press the submit thing, but I can't. So I'm not sure what's going on there.
Okay. Well, how about we just
Scroll down. All 5 questions are in the same
Yeah.
poll.
Okay, let's do all 5 and see what happens. But I will say that I hope that the answer D is not a step. By the way, that's not a good way of writing a multiple choice question either, in case you're writing question. Okay, second question. The proper sequence of the framework presented is. Okay, so we'll just maybe I think what we need to do is answer all the questions and submit at the end.
Yeah, sorry, it looks that way. Sorry about that. Zoom
That's
has some
no
very
issue at all.
specific rules.
So I'm assuming you've answered that one, and the answer there is storage, encoding, retrieval. So we'll go to number 3. Working memory is. Okay, so I actually, in case you're wondering if you've been listening, I actually changed this question at the last minute and I made a mistake. So it's supposed to say unlimited in time. So there's 2 correct answers there, limited in time and limited in space. All right, we'll go to the next question 4. All right, here we go. You're asked to teach an 8-hour course. Which of these techniques would help learners with knowledge retrieval? So here the idea is A is never good. You're not going to get any storage if you teach way too many complex topics. B and C are opposite. So, and B is the best way. So if you can disperse rather than block teach at any level, whether it's curriculum or in a 5-10 minute session, that's better for queuing and retrieval. And the last, what does cognitive load theory tell us? It tells us that even the most skilled teacher, so we've all been in the situation where we teach something, we think we taught it well, and then not that long after we encounter the same learner and it's gone. And it makes us cry and makes us sad, but it has nothing to do with the learner and it has nothing to do with the teacher. It really has mostly to do with the limits of cognition, in that we have limits and which are 2 to 4 complex topics initially, and we have to retrieve to be able to retrieve it later. So that's okay, as long as we promote retrieval. So do we have the answers, Terry? Okay. So answer 1, yes. So heuristics is, yeah, the order is storage, encoding, retrieval. Yeah, that was a faulty answer. So A and B are correct in working memory. Yes, block teaching is better than dispersed. That warms my heart to see 100% on question 4. Yeah, so even the most skilled teacher, you only have 2 to 4. Ensuring, and D is that the reality is, even though someone's acquired the information or placed it in long-term memory, it does not ensure retrieval. Forgetting is a problem with retrieval. It's not a problem with acquisition. And again, the techniques are different for acquisition than retrieval. So Carlos, you said 15 minutes. Sorry, I only left 10 minutes, but I count the poll as 5 minutes. So I leave it to questions.
Yeah, thanks, Sylvain. That was great. I forgot what we were talking about, but it's a great, my memory is not that good.
It was in your email instructions that I should finish at 8:45. So
I know, that's good. No, actually, great tips there. I think, we tend to forget how important this is, and that there's some evidence, and you can do this systematically. I don't know if anyone has any questions. There's Sandeep is asking something there.
Yes. So Sandeep, that's an excellent question. So I don't know if there's any of your cardiology fellows, and here, but they actually asked me to do this session for them in January, I think. And then I had another session with them a week later on a different educational topic. But I started the second session by quizzing them on the first one. And yes, things were gone. Like things were gone very quickly in 1 week. So you're absolutely right. The problem is I will never see you again. But if you ask me to come back on any other educational topic, I will start that session by probably giving you those 5 questions I just gave you and forcing you to go back and retrieve, because yes, even that basic storage and coding retrieval, it leaves quickly. And I proved it with your cardiology fellows, and they're very smart people. And you know, I think I taught it okay, but I think it's just the realities of working memory.
So how do you kind of make it something consistent systematically that you are doing this retrieval process as something automatic with your learners?
Yeah. So it isn't, it's tough. You have to actually, so I think, so I guess it depends on the topic. So if I'm thinking about a Zoom session like this, I force myself when I'm preparing, I say, okay, well, obviously I'll never see this group again, but at least within the confines of this hour, have I done something to promote retrieval? But in a clinical setting, as I mentioned, and I think this is something I've started doing, it's not easy, but I make a note to myself in my phone. If I talked about a topic on Monday, I don't and it's an important enough topic. If it's a esoteric thing, I'm not going to come back to it. But if it's an important enough topic, in that I actually force myself to reteach it or have them reteach it during that session. In a lecture, again, it's you know, in a perfect world, and I think what somebody said is, I think we're guilty in CME. We should start each grand rounds 15 minutes early. Your grand rounds next week should start with a review of this grand rounds. You know, actually, and if we were going to try to promote retrieval, and because it's amazing to me how many times I've been to great sessions, whether it's at a meeting or rounds, and then a clinical scenario comes up maybe a week or even 4 weeks later, and I think, oh, how did I forget what they talked about? And we just do. And so, and I think, yeah, I think a systematic. So I think when you're building, you know, a cardiology course for fellow, whatever, is to build on the previous week in a structured fashion. Force it. Actually tell the next person, you know, you have the first 10 minutes here, you're going to have a few slides to review the previous one. You know, and I think we fail at that in medical education. We are good at acquisition. We're just not as good as retrieval, because I think, Carlos, it does take a bit of work. It actually takes a bit of work to force retrieval. Yeah, so I think you should start RANs for. Can you put the slide up of the overall colorful boxes? Oh, sorry, is that the previous one, I think, or the previous one before that? That's, you mean the yeah, the framework. Previous, I did just the one right before. Yeah. Yeah, that's the framework. Sorry.
So that's what we should show next week before we start rounds.
Yeah, I would say so. You know, and ideally, if you want me, I come back, give you 3 minutes on this, and I think it would be a really that is something that it does take a little work, and you know, and I think we know, even as curricular designers for courses, the cardiology UME course, is that it's tough to get the next person to know what the previous person talked about, but ideally the person on Thursday would review what the people on Monday talked about, you know, give it a few days to mull over and then go back to it. Retrieval is powerful, it's important, but it's probably the toughest aspect of this framework. It takes a little bit of work.
Now, we do record all these sessions. What I don't know is how many times people go and review them again. So
yeah, and actually that's an interesting, because podcasting it really hits the 3 boxes, right? It helps the learners control the input, so it's good for storage. It helps the learner go back and retrieve, so it helps retrieval, it helps coding. So yeah, so recording is great as long as people go back to it, and that's the principle of flipping a classroom.
yeah, So Sandeep is suggesting that we're going to create a schedule of someone responsible for the previous grant rounds summary.
But I think that
Sure,
would be,
be
yeah.
my guest.
But Carlo, yeah, so whoever, like, to think about what you had probably some great sessions in March, April, May on various topics. You know, maybe in a couple of weeks at the end of the academic year, somebody does a review of what you've covered in a very, yeah, and I think that's a really powerful way to retrieve, as long as you stick to maybe one key point of each session.
Yeah, we can do that. You know, we try to put all the rounds together for the year, so I'm sure we can get a volunteer to do that.
Tarek says, I mean, yeah, an educational prescription for somebody to come back, that's retrieval. That's actually also makes it desirable difficulty. It makes it a little harder to learn, and that helps coding. Yeah.
Well, that's great. Sarah has a question there.
Oh, sorry.
Thanks so much, Dr. Coderre. I think this is super helpful. I'm wondering if you could speak a little bit to the lecturers who come to teach and their passion to kind of instill all this knowledge, and they feel that it's the only time in medical school that they're ever going to talk about something that they are so passionate and love, and how that influences the learners, as you've been talking about, ability to retain even maybe those 2 or 3 more basic concepts.
Yeah, so I think the more concepts you introduce, the more you bring in the a bit of a, you don't know which concepts will be remembered. The perfect example I give is that somehow on our acute pancreatitis slide, we still have scorpion bites as a cause. And everybody remembers scorpion bites as a cause of acute pancreatitis, but several learners forget alcohol and gallstones, you know? So we can inadvertently steer away from the topic. So I think what I do now is I always finish so I have 2 or 3 topics in a lecture, and then I present at the end my objectives, a blank slide, and I say every slide that's after this is really, if you're interested, and you can go over it. And that's so I'm done with the important part here. You know, I'm done. I've given a chance for you to think about the important parts. And I think, you know, and you could couch it as this is just for interest, you know, you could, so that way we can actually kind of shut our brain off to and remember what's key. So I've actually overtly told you what's key. This is out of interest, and this is why we have podcasts, and students can go back and retrieve that. And I say, you know, if you want to read that or learn about that later. But for today, this is all that I'm going to focus on. The rest of those slides, if you're interested, go for it. Because the reality is that those 5 words, we have already covered that does not jive with human cognition. And if you introduce 12 topics because you're passionate about it, you have no idea which of the 12 are going to be remembered, if any. And it'll be scorpion bites potentially, and not gallstones or alcohol.
Yeah, it's one thing in our ability to like really kind of prioritize what's likely. I think we lead our learners astray by giving them all this variety of things and thinking that those things are potentially equal in weighting.
Yeah.
Okay, well, thanks, Sylvain.